Today is World AIDS Day, and while the world is fixated on the ongoing coronavirus pandemic, the HIV AIDS pandemic continues to impact millions on a global scale. In the U.S. alone, there are currently more than 1 million Americans living with the disease, and according to the CDC, there are roughly 40,000 new cases each year. The disease is largely spread through sexual contact, predominantly impacting the LGBTQ+ community, along with people of color. In honor of World AIDS Day 2020, the Human Rights Campaign has recommitted its efforts to fighting to end HIV and AIDS. The organization launched multiple efforts to destigmatize the disease and shed light on some ongoing misconceptions surrounding the disease. Alphonso David joins me now to discuss. He's the president of the Human Rights Campaign. Alfonso, welcome. Great to have you with us. So we have witnessed HIV and AIDS disproportionately impact the LGBTQ+ community and communities of color for decades on a global scale. After all of these years, why does that continue to be the case?
Well, first, thank you for having me. Unfortunately, we're seeing in many parts of this country that lack of access to health care presents a significant problem. The second problem that we face is stigma. The virus continues to disproportionately affect members of the LGBTQ community. As an example, the risk of contracting HIV is 1 in 6 for gay and bisexual men. And if you are a Black man who happens to be gay or bisexual, you are likely to get HIV 1 out of 2. For Latinx men, is 1 out of 4. And the numbers are staggering for people of color in this country because, unfortunately, there is a stigma associated with HIV. There's a lack of access to health care that, unfortunately, impacts many marginalized communities, and we have to change that. Many people believe that HIV is dead, that it no longer affects people, that people are no longer dying of HIV, and that is not the case. Unfortunately, today, people are still dying of HIV.
And so your organization has announced a partnership with the Prevention Access Campaign to launch the Undetectable equals Untransmittable campaign, also known as U equals U. Tell us about the purpose of this campaign and what issues do you hope to shed some light on about HIV and AIDS through this effort?
So our objective here is to really fight misinformation. Fighting HIV and AIDS start with fighting misinformation. Some believe that you can get HIV by sitting next to someone else, or you can get HIV by simply being in the same room with someone else. And that is not the case. As you said when you opened this conversation, sexual activity and blood are the 2 ways that you can contract HIV. Now, even with those transmission channels, there are ways to prevent contracting HIV. So the Human Rights Campaign is partnering with Prevention Access Campaign on a new campaign, Undetectable equals Untransmittable. And we're issuing a guide that really tries to provide people with more information about stigma and addressing the misinformation that we're seeing. This movement is a global movement. We have more than 1,000 official partners in more than 100 countries that are sharing the message that people on HIV medication with an undetectable viral load cannot transmit the virus through sex, even without condoms. That is an important fact for people to know. And so we're trying to get out this information so people can educate themselves about HIV and how to prevent the transmission of HIV.
And why is there so much misinformation online about this epidemic specifically? I mean, we have seen with other medical issues, including COVID, we can see that misinformation spreads rapidly. But it seems that when it comes to AIDS, some of this misinformation it's very tricky to get at. I mean, the stigma around it, for instance, has stuck around for years. Why is that the case?
So much of the perception of HIV and AIDS was driven based on stigma against LGBTQ people, sort of a fear of LGBTQ people in the 1980s. Some people may remember the federal government largely failed to recognize people dying of AIDS. We had thousands of people dying of AIDS before it could even be recognized as a condition that could kill you. And unfortunately, we're seeing some of the same responses today with the federal government that ignored and attempted to diminish the horrific impact of COVID-19. So when we think about HIV and AIDS and we think about the stigma that was created in the 1980s and unfortunately has lived since then, it's really attached to the people that were most impacted. Gay men, transgender people, people of color. Those were the populations that were disproportionately impacted with HIV. And so over the years, we've tried to educate people on how you can actually contract HIV. And it's not the way people thought. They assumed, again, that you can get HIV by sitting in the same car as someone. That is not the case. And unfortunately, there was very little education done by the federal government. That stigma, unfortunately, perpetuated itself over time. So we have a lot of work to do to make sure people are educated on the impact of HIV. How do you transmit HIV so that we can actually end this epidemic? It is still killing people today, and that is large part because of misinformation that is being peddled through over the years.
And one area where that stigma continues to affect sort of Americans' health, which we found out recently when we started doing stories about people who wanted to donate their plasma after they had COVID, within the blood transfusion or donation world, gay men are still not allowed to freely donate blood, even though there are plenty of testing methods in place to make sure that their blood is safe. So that's one area where that stigma is sort of a holdover from the 80s and hasn't fully been erased yet.
Yes, and it's in 1980, gay men were banned from giving blood. That policy has changed over time so that gay men and bisexual men can give blood, but only after waiting for a substantial period of time. The Health and Human Services Agency has now amended their policy so that the deferral on blood donation for gay and bisexual men is gone from 1 year to 3 months. But this change continues to effectively effectively bar a vast majority of gay and bisexual men from becoming blood donors. The underlying policy is discriminatory. It effectively says that if you are a gay man, you are going to be viewed as suspect. You cannot give blood, and we're living through another pandemic where people are attempting to really help friends and family members and donate blood.
Absolutely. And Alfonso, President-elect Joe Biden has vowed to protect and advance the rights of the LGBTQ community. What types of policy changes would you like to see enacted, to combat AIDS, but not just to combat AIDS, to sort of promote the community in general from the incoming Biden-Harris administration?
So the Human Rights Campaign released a blueprint for positive change. We released it last month. It's an important brief that includes about 85 individual policy recommendations reaching across the federal government, and we really aimed at bettering the lives of LGBTQ people. One example is to ensure that providers that are participating in the federal health programs provide information about PrEP and other HIV and STI prevention tools. They don't do that now. Although federal health programs, including Medicare and Medicaid, cover preventive care, many healthcare providers still fail to consistently identify patients at the high risk of contracting HIV, and they could change that. So we're asking the Biden-Harris administration to make that change. In addition to ending discrimination against gay and bisexual blood donors and others, we need to educate people about transmission of HIV in the prison system. The HIV rates, unfortunately, is very high in the prison system because we're not taking effective measures and not only educating people, but also engaging in preventative care.
Well, Alphonso David, thank you so much for telling us about all the important work you're doing. We appreciate your time.
Thank you for having me.